If you're experiencing lower back pain, neck pain, aches and pains, or injuries from a car accident, you need to see a licensed chiropractor. Don't suffer any longer dealing with pain. Our experienced chiropractic team can help you start feeling better in just a few visits. The best part is, treatment involves no drugs and no surgery. We're committed to bringing you better health and a better way of life by teaching and practicing the true principles of chiropractic wellness care. So contact us now to set up a free consultation. You've got nothing to lose but pain.
Okay. Okay, so we started discussing the MRI, and so basically all you do is just basically standing on your feet all day long, right?
Yes.
And then
going up and down stairs.
Going up and down stairs.
That's
And you stating that you have never had any serious injuries in the past?
not that I can remember.
Okay. And your main symptom is the shooting pain down your leg?
Well, it's not as much down the leg anymore. It's more centralized in the back.
Mm-hmm.
But it was there. Now it's starting to shoot back out to my hip again.
Mm-hmm.
And that's why I'm coming in.
Okay.
There's a sharp pain right on the hip bone. And before I had my diagnosis with the MRI, I was rubbing my hip.
I see.
But that,
So, and in 40 years plus of your life, you never had chiropractic care?
no.
Okay. Well, I'll look at your MRI and it, you know, the degeneration and the way the disc, the intervertebral disc are leaking out, it's pretty intense. I mean, it's pretty late into the stage. And what, did you see an orthopedist or neurologist?
Neurologist.
And what did he offer?
He just offered to go down and get the MRI done.
Mm-hmm.
And then he prescribed some, I forgot what it was, a nerve blocker.
Okay.
Real
What
mild.
about the surgery? Did he offer surgery as well?
I didn't see him. He scheduled an appointment to see the surgeon, and while I was waiting for him to get back to me, I called the neurosurgeon back, and I said, I'm going to go down for physical therapy. I don't want to do surgery yet.
And how many sessions of physical therapy did you have?
About 12, 14, something like
It's
that.
with zero results.
No. Well, there was instant relief when they were rubbing right in the area. And as soon as I stood up, it was the first time I hadn't feel pain. And I was just, wow.
Good.
But then, 2 hours into work the next night, a couple of trips up and down the stairs, and the hip was back.
Okay. What's the level of pain in your low back, 1 to 10?
At this time,
Yeah.
maybe between a 2 and a 3.
And it's worse?
At its worst, probably a 5, 6, 5.5. It's more of an annoyance. It's just constant. I can't-
Well, let's see what the chiropractic care can do for you, and we'll go from there. Let's- I'm going to look at your entire spine anyway, so we're going to adjust your entire. Relax. Okay, bend forward, please. Back. Forward again. Okay. Okay, stand up please. Face the window. Okay, march in place. Stop. Okay, have a seat please. Take this. I'll be right back. So basically, this is you looking at yourself from behind. What's causing all this pain and trouble is that your pelvis, the right side of your pelvis, is about 2 inches lower than the left side. So it's causing a lot of pain and discomfort in this area, and it's also lacking the range of motion on the left side of your lumbar spine. Okay.
So that's the pain over here.
Well, that's the problem is here and the problem is here. So we need to fix you here and we need to fix you here. And then spine is a gravity dependent structure, so the rest of the spine is kind of compensating. So I'm going to adjust your middle back and your neck as well. But this is where the problem is, and 2 inches difference is a big deal. That's why. So one side is overworking and the other side is not working too hard. So every time you put the load on, when they rubbed it or whatever they did, physical therapy, they probably relieved the tension in the muscle. But as soon as you load it up, it went back to playing because the biomechanical problem hasn't been fixed. Okay, well they're not trained to do it. But anyway, what I'm gonna do, I'm gonna set you up for the first time in 40 years plus of your life on a heat and stim. I'm gonna try to relax this area so the muscles don't guard as much. Okay, and then I'm gonna adjust you. And after adjustment, I'm gonna send you to Gail, and I will see how it goes after your first visit.
Okay.
Okay. Do you have any questions?
No, not at
No?
this time. No.
Fix me. Yeah.
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 Sounds like it's a mess.
It is a mess.
Working this though. This will be next week. Will be the 3rd week in a row.
So this is your second session, and the first time I come in, you had this severe pain in your low back that shoots down your leg, etc. So how do you feel? What's the percentage of improvement after your first session?
Probably 70%.
70%. And you had what, 14 sessions of physical therapy and all kinds of other consultations, and nothing really helped?
No. Once I started doing physical activity, maybe it only helped for about an hour.
Wow. And so on Tuesday you went back to work, and you were able to work for how many hours without any pain?
About 3.
3, and then you did a break, and then you were able to finish a shift without any pain?
Yes.
So basically just one episode of pain with what, how long was the break? 15 minutes?
Yes.
And you were able to finish without any problems?
Correct.
That's pretty cool. Did you have any pain today?
Just a little bit in the hip.
Okay.
Radiating out into the hip.
Okay.
But it feels more like dislocation or some kind of misalignment or something.
Okay. No, nothing major as it was before.
Not like it was before, no.
That's awesome. Okay, put your hands down. Okay, take a deep breath in. Out. Okay, good. Out. Okay. Out. Go on your side, face me please, like you sleep on your side. How's your neck, by the way?
It's okay.
Yeah?
Maybe this vertebrae right here.
Okay.
It's a little tender.
Okay. But back was the main one, because your
Yes.
your MRI didn't look very good.
No.
Okay. Relax your shoulder. Sit up.
I have 2 pops at a time.
Put your feet down on the floor. This one. A longer spine. What? Oh, okay, good. All right. Back to normal.
Yeah.
Yeah. Okay, awesome. Yeah, pretty good results considering that your MRI was not very promising. So I'm happy for you.
Yeah.
Let's go see Gail.